All right, well, thanks everybody for being here. Good afternoon. Welcome to Bluff Plantation in Augusta. This is a unique collaboration between the Medical College of Georgia, GRU, and RiverMend Health. I'm Dr. Bill Jacobs. I'm the Chief of Addiction Medicine at MCG GRU and the Medical Director for the Bluff Plantation. Thanks again for everybody for coming out to celebrate this. This is a historic event. I am so proud and so excited to be back in Georgia. This is home for me. As many of you know, I'm a Georgia native, born and raised in Gainesville, Georgia, and a graduate of the University of Georgia, and proud graduate, got the ring of the Medical College of Georgia, class of '81, and with the help and support of many friends and colleagues, especially Dr. Peter Buckley and my chairman, Dr. Vaughn McCall, we're really changing the paradigm for the treatment of patients who suffer from the disease of addiction. You know, addiction has more stigma associated with it than any other disease. Even with parity, patients and families are often too embarrassed to ask for help. And when they decide they need help, they don't know where to turn. Most university academic medical centers don't have experts trained in addiction medicine or treatment programs. We have both. This treatment facility, for many folks, you know, treatment's been a revolving door of detox and episodic short treatment, really responding only to crises and relapses. We know that airline pilots and physicians and attorney addicts recover. You know, studies have shown they recover, return to their families, and have full productive lives. They know detox is just the first step, but it's not treatment itself. We know that treatment works when it's delivered continuously, not episodically, in the right dose. I've worked for over 15 years with professionals where we've seen it happen, and we've reported our successes in peer-reviewed journals. Now we're taking that proven, successful treatment approach to all patients, not just doctors, nurses, airline pilots. We learned a lot about treatment from Mrs. Betty Ford. She moved treatment to a remote location at the time in Palm Desert. She insisted on a healthy diet, exercise, meditation, and yes, she recruited some of the top physician experts as full-time evaluators and healers. It takes a team, though, a setting away from crisis and craving, time and energy to recover. But it also takes experienced professionals, including therapists, nurses, recovery coaches, exercise physiologists, dietitians, and chefs. Fortunately, we have at our disposal the full resources of the academic experts in technology at MCG. We have access to the best neurologists, internists, infectious disease experts, cardiologists, gastroenterologists, of course psychiatrists and other experts. Often we need those experts to clear up the consequences of past use, abuse, and addiction. Just a couple of weeks ago, one of our first patients arrived. I met him in our level 1 trauma emergency department. The patient came after a successful detox, but had tremendous craving and anxiety. He had chest pain, and he admitted to us on arrival that he'd previously been told he had a heart attack, but no follow-up. In just a few hours, with the help of our experts at MCG, we were able to evaluate and stabilize him and get him into treatment out here where he's doing well. On the 3rd floor of MCG's primary teaching hospital, we have an inpatient unit where complicated patients can be safely and humanely evaluated, detoxed, and stabilized, and where all their co-occurring medical and psychiatric conditions can be evaluated and treated by experts from all medical specialties. This is unique and much needed. We have already admitted and treated patients with alcohol problems and severe depression, drug problems and real chronic pain problems, drug use that people have been doing to help deal with their past early life traumas. Then they're ready to come out to this magnificent setting. The Bluff Plantation facility has a healing atmosphere. The environment is right to start over, to remember and build on the past, and to move forward toward recovery. Residential treatment works because the addict is safely removed from cues and cravings, and where the psychology, counseling, therapy, 12-step, trauma, mindfulness, meditation, exercise, and other modalities can be given by our team of experts here. We've handpicked this team. Who wouldn't want to work here? Hey, look around. To provide them, these patients with the most intensive dose of treatment necessary, many hours each day, and to allow them to make safe and successful transitions back to their families and loved ones. But we don't stop there. We'll continue to follow and support our patients with family work, meetings, recovery coaches, telemedicine, random urine drug testing for 2 to 5 years after their stays here. We know that works for doctors, nurses, pilots, and we do it because it works and because we want our patients to remain in lifelong recovery and avoid chronic relapses. So, as you can tell, I'm just very proud to be home. Proud to be a part of this MCG mission. Thanks you all for coming.